Ladies and gentlemen, yeah, this is it. This is the real thing. This is the hospital doctor office that I do notes in. It's the end of the day, and I thought it might be fun to take my list and just review some of the patients that I've seen today, some of the themes of sick people and what gets them sick. So you can kind of learn from some of the stuff that I see day in and day out of what really matters, what lifestyle stuff, what behaviors land people in the hospital, how people end up, dying and really suffering of serious disease, what you can do to prevent that. It's going to be an interesting thing. I'm just going to run through this. Um, Late 40-something-year-old female with diabetes who came in with a blood sugar. She's on a ton of insulin. 5, 10 units is a little bit. She's on 100 units of insulin at home, and her blood sugar was still over 500. She came in with chest pain and various complaints, was dehydrated, had some renal failure, but it was all because her blood sugar was super high for too long, which is incredible that she's on that much insulin. Um, Talking to her, she knows to tell me she should eat vegetables and stay away from rice. I think she does eat, she did admit to probably eating too many tortillas. Doesn't have a lot of soda, but executing a better diet, of course, for her would help that blood sugar, in addition to finding the right dose of insulin, which just takes time, going back to her regular doctor over and over. I'm going to try to help her with that here. But then also, she walks about a block, about 10 minutes, a couple times a week. Probably not going to get it done. Somebody like that really needs to be up walking an hour 5 days a week, at least 30 minutes 3 days a week, getting some better exercise to help lower that blood sugar. Diabetes. They had a guy who had a seizure from alcohol. This guy drank 6 to 12 beers. He was in his 50s, mid 50s. He'd been doing this for decades. It made me laugh because he said he drinks 6 to 12 Bud Lights. My beer of choice. But too many. And when he stopped drinking and took a couple days off, he went into alcohol withdrawal, got shaky, and had a seizure. Alcohol, addiction, landed that guy in the hospital. Another diabetic, mid-50s, who's getting his third toe cut off. He already had 2 of the other ones cut off. This guy actually has pretty decent blood sugar. So normal blood sugar's 100, 150. His has been in a decent range. The problem is that he has had bad diabetes for too long, for probably, 10 or 20 years maybe, where it's been severe. His arteries are damaged, his nerves are damaged. So when he gets a little infection, even when he does a good job with his diabetes, diet, exercise, taking his meds and his insulin, so much damage has been done that it's really difficult to treat that infection. This guy actually had already had 6 weeks of antibiotics and had all this treatment, and it still failed, and he has to have it cut off. Unfortunately, so hopefully cut this off, stop it there, and it won't progress to where he loses his foot or his leg as that infection continues to kind of progress up. I think one of the points with this is that sometimes damage is done and it is irreversible. Unfortunately, there are limits to technology right now, and if you fry out all your arteries in your whole body, especially those ones in your feet and toes from diabetes, we can't fix that. We cannot reverse that, and these folks suffer. These guys suffer. But there's another one with diabetes. Another alcoholic who came in. This is a young guy in his 20s who had been binging, drinking too much, and it flared his pancreas, gave him some abdominal pain and vomiting, and he got pancreatitis. Went in, I had a good talk with him. He seemed to be in a place where he wants to talk about sobriety. And I kind of asked him a little bit. He'd been drinking since he was an early teenager, and said his father was an alcoholic, unfortunately, kind of the primary model of that behavior. But then also his father actually is now sober and had been for some time. So hopefully that relationship is good enough to where his father can help him and can guide him to sobriety. I would be a little concerned about what kind of a place his father's in and what kind of an influence that would be, but certainly better that he's sober than not continuing to drink. But again, addiction, alcohol has landed this guy in the hospital. We had a psych case that swallowed a paper clip Voices told her to do that, so psych is an issue with that one. 60-year-old guy with bad lungs with emphysema from smoking. We still see a fair number of guys that smoke. This guy actively smokes, and it flared up his lungs. He came in, needing oxygen and steroids and all these things to slow it down. Kind of not easy to do, but pretty easy to diagnose. The problem is smoking, and one of the treatments and solutions and prevention is just don't smoke. Don't start. If you start, there's a lot of things to help you quit, but stopping smoking here for this guy, he wouldn't be in the hospital if he didn't smoke, without a doubt. But similarly, a lot of damage has been done now that this guy's in his 60s and has kind of been smoking a pack for 3 to 4 decades. A late 50-year-old female who had prior surgery and gets urine infection. She came in with a urine infection. Similarly, a diabetic who she knows her blood sugar runs in the 300s, and she just doesn't consistently take her insulin and take her meds, and that also suppresses her immune system and makes her at risk for these urine infections. So she landed in the hospital partly due to her diabetes, which was not well controlled. Another 50-something-year-old woman with pancreatitis. Her cause was not alcohol, so sometimes there are cases of pancreas inflammation that we don't know the cause of. We call that idiopathic. We don't know the source. Treat her just the same. She'll get better. No real lifestyle things I can think of with her. 60, this is sad, 60-something-year-old woman who had a hip fracture. She fell and had a hip fracture. What brittle bones in weak condition. Again, not staying active, not lifting weights. My 90-year-old grandma lifts weights and reduces her risk of osteoporosis and falling and breaking her hip. This is a woman in her 60s who had gotten so weak that she fell and broke her hip. Conditioning. This stuff is preventable. Active lifestyle, exercising, taking care of yourself. When needed, taking vitamin D and calcium supplements or Fosamax or whatever for osteoporosis. But again, most of these things, as you go through this and you start to see how much of this is diabetes, addiction, not taking care of yourself, not staying in shape. These folks begin to get into their 50s and 60s and start to suffer in ways that are entirely preventable, but they're catching up to them when they get to this age. Another female in her late 60s who had a stroke just from high blood pressure, something that is very easily controlled with medication and prevented. There's a lot of things you can do: exercise, diet, reducing salt, DASH diet, etc., to lowering your blood pressure kind of naturally. But meds are there, they're easy, and a good way to get control of that and prevent these just terrible, sad things. Her speech was severely affected. She can barely talk now from this stroke. She could still walk. Thankfully, she wasn't in a wheelchair. But blood pressure got her on this one. And she still smokes. Ugh, I couldn't believe that. And finally, a 60-something-year-old female who was pretty obese, who got pneumonia. I don't know if she was in better shape, more active, taking better care of herself. Maybe if she wouldn't have got this kind of bacterial infection in her lungs. So, look at this. This is just kind of 10 of these patients, 10 or 11 of these patients, but let's count out the number of diabetics. 1, 2, 3 or 4 of them that landed in here from uncontrolled diabetes. 2 were alcohol related. I had 2 or 3 smokers. So basic lifestyle stuff. And then a couple people that, it wasn't really life, but overwhelmingly most of these 10, 11 patients, food, exercise, and substance use, nicotine, tobacco, alcohol. This is just today's list. So, and the other gal being kind of conditioning, exercise, the strength of her body and stuff. So So what I want people to take away from this is, what things should you focus on? Your weight, having a healthy weight for your height. Um, Eating well, a lot of vegetables, like protein, avoiding processed food, junk, sodas. Take whatever conditions and risk factors you have, mainly high blood pressure, diabetes. High blood pressure, diabetes, and weight, kind of focusing on those and getting those taken care of. I would do it as soon as possible with medication, um, but also encourage lifestyle stuff all the time. But if you using meds can keep you out of the hospital, and getting on top of these things, and then eliminating stuff that's going to kill you. Like smoking excess tobacco, smoking excess alcohol. A drink or two every night for most people is probably okay. A 6-pack or 12-pack every day is a little too much of a party. It's going to land you in here like a couple of these guys. One guy with the seizure, another guy with a pancreas problem. Alcohol related stuff is very common. So that's the reality. That's kind of what I see on this side. I was in the hospital rounding today, seeing these patients. I'm going to see a lot of them tomorrow, kind of continue these conversations on living a healthier lifestyle. But this is some of the reality of these diseases that you may not initially see problems when you're drinking a little bit in your 20s and 30s. You start to get some weight in your 30s and 40s. But these guys, as they get into their 50s and 60s, it's really catching up to them. They're not going to make it to their 70s, 80s, and certainly not their 90s. Maybe into the 70s, but 80s and 90s, it's unlikely, to have this severe disease, this bad, emphysema from smoking, the diabetes, this guy losing his toe, or these people with blood sugars of 3 and 500, they're just off the chart. Damage will be done, unfortunately. Hope that wasn't too much of a dose of reality, but that's what I see every day. So I'll kind of do one of these. I'm going to do these kind of periodically, just to kind of check in and give you some reality checks and reminders to keep this stuff in control, and to kind of give you a better sense of, what really is important, what things really do matter in the sense of making people sick, and ultimately cutting their lives short, robbing them of the lives I think all of us really want. Thanks for watching, and I'll catch you on the next one.